Perhaps the most alarming health scare of our lifetimes, COVID-19. The coronavirus has been fatal for thousands and changed the way we go about our daily lives. Now, terms like social distancing and shelter in place are part of our everyday conversations. So, where do we go from here?
So we have the expertise here to try to combat this pathogen as well as other pathogens. And pulling them all together under this one umbrella of One Health.
Deborah Miller is a veterinarian in wildlife health at UT's Institute of Agriculture and leader of UT's One Health initiative. One Health includes investigating zoonotic diseases, infections that can jump from animals to humans. The initiative addresses COVID-19, but also goes beyond coronavirus. There are also plans to combat chronic wasting disease in deer, the Asian longhorn tick in livestock herds, diseases impacting bats and pollinators, antibiotic resistance, invasive species, and plant pathogens. This initiative focuses on animal and environmental health issues that also impact humans. For us to stay well, we need the world around us to be safe and healthy. Biodiversity is critical.
And if we have a healthy environment, we can be healthy. So you have a healthy environment, you have healthy animals, you have healthy plants, and then you have healthy people.
Our world is intertwined: people, animals, plants, and the environment. For instance, experts believe the coronavirus started with bats and other animals.
Today, in today's COVID-19, there's another perfect example of transmission between wildlife and human.
UT Ag Research Dean Hongwei Shin says UT has a diverse team in place to lead One Health.
So this is the reason that we're forming great partnerships between UTIA and UTK and Oak Ridge National Lab. So because it really takes all kinds of expertise from animal scientists, microbiologists, the veterinarians, engineers.
A goal for this initiative is to keep people, animals, plants, and the environment all healthy. It starts with a dedicated effort to combine our knowledge and skills, and that's true in times of good health and bad. This is Charles Denny reporting.